If you're curious about vision loss in younger people, you need to know about Stargardt disease. Stargardt disease, also known as juvenile macular dystrophy, is the most common inherited macular dystrophy. It's a major cause of central vision loss in people under 50. The culprit? A fatty substance called lipofuscin that builds up in the retinal pigment epithelium, or RPE. There are 3 types of Stargardt disease. STGD1 is the most common, caused by mutations in the ABCA4 gene and inherited in an autosomal recessive manner. Less common are STGD3 and STGD4, both inherited in an autosomal dominant way and linked to different genes. Typically, it shows up in childhood or adolescence, though sometimes it appears later. Unfortunately, once vision drops below 6/12, it can decline quickly before stabilizing around 6/60. But here's a silver lining: those with early-stage flex can stay symptom-free for years. So while the journey with Stargardt disease can be challenging, understanding it is the first step toward managing it.
It has an estimated incidence of about 1 in 8,000 to 10,000 people. Typically, it presents within the first 2 decades of life, but central vision loss may not occur until later. Now let's talk about the genetics. The main player here is the ABCA4 gene, which is localized to chromosome 1p21.22. This gene is quite large, with over 900 identified disease-causing mutations. Around 60 to 70% of patients with Stargardt disease have a detectable mutation in the ABCA4 gene. Interestingly, it's estimated that about 1 in 20 people are carriers of this mutation. So, what does ABCA4 do? It encodes a protein that's involved in the visual cycle. However, when there's a mutation in ABCA4, it leads to the production of a dysfunctional protein. This causes a buildup of lipofuscin in the subretinal space. Lipofuscin is a complex mixture of bisretinoid fluorophores accumulated by retinal pigment epithelium (RPE) cells. Unlike other cells in the RPE, lipofuscin forms from a non-enzymatic reaction of vitamin A aldehyde in photoreceptor cells. This material is then transferred to the RPE via the phagocytosis of photoreceptor outer segments. In recessive Stargardt disease, also known as STGD1, the formation of lipofuscin is accelerated, leading to cell death. Interestingly, carriers, though they have the mutation, are unaffected. Mutations in ABCA4 can also lead to other retinal diseases such as age-related macular degeneration (AMD), retinitis pigmentosa (RP), and autosomal recessive cone rod dystrophy. These ABCA4-related dystrophies likely represent a spectrum of phenotypes with overlapping retinal changes, showing great variability in their clinical expression. But wait, there's more. In addition to recessive Stargardt disease, there are rarer forms inherited as dominant traits. For example, autosomal dominant Stargardt disease, known as STGD3, is caused by mutations in the ELOVL4 gene. This gene codes for a photoreceptor-specific membrane-bound protein that plays a role in long-chain fatty acid biosynthesis. Several other retinal diseases are mapped near ELOVL4, including retinitis pigmentosa, Leber's congenital amaurosis, cone rod dystrophy, North Carolina macular dystrophy, and early-onset dominant drusen. So there you have it, folks. Stargardt disease is a complex condition with a fascinating genetic background. Understanding its epidemiology and pathogenesis is crucial for any aspiring ophthalmologist or medical professional. This disease causes progressive vision loss, usually beginning in childhood or adolescence. While there's no cure, early diagnosis helps manage the condition and explore potential treatments. The most common symptom of Stargardt disease is gradual loss of central vision. This makes activities like reading, recognizing faces, and driving difficult. Colors may appear faded or washed out, a symptom called reduced color vision. People with Stargardt disease may also experience difficulty adjusting to darkness, known as dark adaptation problems. These symptoms occur because Stargardt disease damages the photoreceptor cells in the macula. Photoreceptor cells are responsible for converting light into electrical signals that the brain interprets as images. When these cells are damaged, our central vision becomes blurred and distorted. Ophthalmologists use various techniques to diagnose Stargardt disease. One important tool is an eye exam with pupil dilation. allowing a clear view of the retina. In the early stages, the macula may appear normal. As the disease progresses, characteristic changes become visible. The macula may develop a mottled appearance with dark and light patches. Another common finding is the presence of snail slime, a yellowish, glistening material that accumulates in the macula. In later stages, the macula may take on a beaten bronze appearance due to pigment clumping. Section 4. Yellow-white lesions, a telltale sign. A hallmark of Stargardt disease is the appearance of yellow-white lesions called flecks. These flecks are deposits of lipofuscin, a fatty waste product that accumulates in the retinal pigment epithelium, or RPE. The RPE is a layer of cells that nourishes and supports the photoreceptor cells. These lesions are typically found outside the macula in the early stages of the disease. Over time, they may extend into the macula, contributing to central vision loss. The presence of flecks, along with other macular changes, helps ophthalmologists confirm a diagnosis of Stargardt disease. Section 5. Understanding progression. How Stargardt disease unfolds. Stargardt disease is a progressive condition, meaning vision loss worsens over time. However, the rate of progression varies greatly from person to person. Some individuals experience slow progression while others experience more rapid vision loss. As the disease advances, new lesions may appear and existing lesions may enlarge or change shape. This ongoing damage to the macula leads to further deterioration of central vision. While Stargardt disease doesn't typically lead to complete blindness, it can significantly impact daily life.
Diving into the essential steps for diagnosing central vision loss, let's get straight to it. First up, visual fields. They show central loss, which is crucial for pinpointing the issue. Microperimetry is another tool in our kit that helps document progression accurately. Next, we've got OCT, or optical coherence tomography. It's fantastic for revealing flecks and areas of atrophy. These visual cues are big red flags when it comes to central vision loss. Now, let's talk FAF, or fundus autofluorescence. This technique shows hyperautofluorescent flecks and hypoautofluorescence around the peripapillary and macular regions. This can be key for early diagnosis. Moving on to ERG, or electroretinography. In these cases, the photopic response is usually normal to subnormal, while the scotopic response might still be normal. EOG, or electrooculography, however, is often subnormal, especially as the condition advances. Fluorescein angiography, or FA, is another must-use diagnostic tool. Look for the dark choroid effect, which occurs due to diffuse RPE abnormalities. In the macula, you'll see a mix of hyper and hypofluorescence. Fresh flecks block early fluorescence but show late hyperfluorescence due to staining. Old flecks, on the other hand, reveal RPE window defects. Lastly, indocyanine green angiography, or ICGA, can show hypofluorescent spots, often more numerous than clinically evident. So there you have it. Using these diagnostic tools effectively can make all the difference in identifying and managing central vision loss. Keep these tips handy and ace those diagnoses.
When we think of vitamin A, we often associate it with good vision. Ironically, for individuals with Stargardt disease, high doses of vitamin A can be detrimental. This is because vitamin A can contribute to the buildup of toxic substances in the retina, exacerbating the disease process. People with Stargardt disease are advised to avoid vitamin A supplements and limit their intake of foods rich in preformed vitamin A. This includes liver, fish oil, and fortified dairy products. While vitamin A is crucial for healthy vision in the general population, it's essential to understand that certain conditions like Stargardt disease require a different approach. Consulting with an ophthalmologist and a registered dietitian is crucial for personalized dietary recommendations. They can guide individuals with Stargardt disease on maintaining a balanced diet while minimizing potential risks associated with vitamin A. Docosahexaenoic acid, or DHA, is an omega-3 fatty acid that plays a crucial role in maintaining the health of our eyes, particularly the retina. For individuals with Stargardt disease, DHA offers a potential protective effect. Studies suggest that DHA can help reduce the accumulation of toxic byproducts in the retina, slowing down the progression of the disease. DHA achieves its protective effect by promoting the formation of a pigment called retinal ester, which is less toxic than other vitamin A byproducts. This action helps safeguard the sensitive photoreceptor cells in the retina from damage. While more research is needed to determine the optimal dosage and long-term benefits of DHA in Stargardt disease, incorporating DHA-rich foods into the diet is generally recommended. Fatty fish like salmon, tuna, and mackerel are excellent sources of DHA. Supplements are also available. Gene therapy has emerged as a revolutionary approach to treating genetic disorders, and Stargardt disease is no exception. This cutting-edge therapy aims to address the root cause of the disease by delivering a functional copy of the ABCA4 gene to the retinal cells. The process often involves using a harmless virus as a vector to carry the healthy gene into the target cells. Once inside the retinal cells, the functional ABCA4 gene can start producing the necessary protein, potentially halting or slowing down the progression of vision loss. Gene therapy for Stargardt disease is still in its early stages of development. However, several clinical trials are underway, investigating the safety and efficacy of different gene therapy approaches. These trials provide a glimmer of hope for patients and their families, offering the potential to preserve and even improve vision in the future. Among the promising gene therapy trials for Stargardt disease, one stands out, the SAR 422459 study. This trial focuses on delivering a functional ABCA4 gene directly to the retinal pigment epithelium, or RPE, which is a layer of cells that nourishes and supports the photoreceptor cells. The SAR 422459 gene therapy utilizes a modified lentivirus as a vector to deliver the ABCA4 gene. The virus is carefully engineered to be safe and effective in targeting the RPE cells. This approach aims to halt the accumulation of toxic substances in the retina, preserving the photoreceptor cells responsible for vision. The SAR 422459 trial has shown encouraging early results, demonstrating the safety and potential efficacy of this gene therapy approach. Patients treated with SR 422459 have shown improvements in visual function and a reduction in the progression of retinal damage. Section 6. RPE cell transplantation, another promising avenue. In addition to gene therapy, researchers are exploring another promising avenue for treating Stargardt disease, RPE cell transplantation. This approach involves transplanting healthy RPE cells into the retina to replace the damaged ones, restoring the vital support system for the photoreceptor cells. One clinical trial investigating RPE cell transplantation utilizes human embryonic stem cell-derived RPE cells, or HESC_RPE cells. These cells have the potential to differentiate into functional RPE cells, providing long-term support and protection for the photoreceptor cells. The HESC_RPE cell transplantation trial involves injecting the cells subretinally, placing them in close proximity to the damaged RPE layer. This procedure aims to improve the microenvironment of the retina, promoting the survival and function of the photoreceptor cells. Section 7. Exploring additional treatment options. Beyond gene therapy and RPE cell transplantation, researchers continue to explore additional treatment options for Stargardt disease. These include saffron, a spice that contains crocin, an antioxidant that may protect retinal cells from damage, ALK001, an oral medication that aims to reduce the formation of toxic vitamin A byproducts in the retina, MP4, a drug candidate that targets a specific pathway involved in the accumulation of toxic substances in the retina, and DHA supplementation, as mentioned earlier. DHA, an omega-3 fatty acid, shows promise in slowing down disease progression. While these treatments are still in various stages of development, they offer a glimmer of hope for patients seeking to preserve their vision and improve their quality of life. The ongoing research and clinical trials are crucial for determining the safety, efficacy, and long-term benefits of these potential therapies. Section 8. Understanding the variability of Stargardt disease. It's important to note that Stargardt disease can present with a wide range of severity and progression rates, even among individuals within the same family. Some individuals may experience slow disease progression, retaining good central vision for many years, while others may experience more rapid vision loss. Factors influencing the variability of Stargardt disease include the specific gene mutation inherited, environmental factors, and individual lifestyle choices. This variability highlights the importance of personalized treatment plans tailored to each patient's unique needs and disease progression. Regular eye exams, genetic testing, and open communication with an ophthalmologist are essential for individuals with Stargardt disease. Early detection, close monitoring, and appropriate interventions can help manage the disease and optimize visual outcomes. Section 9. A brighter future for Stargardt patients. Stargardt disease, while challenging, is not an insurmountable obstacle. Ongoing research and clinical trials offer a beacon of hope for patients and their families. Gene therapy, RPE cell transplantation, and other emerging treatments hold the potential to preserve, improve, and perhaps even restore vision in the future. As our understanding of Stargardt disease and treatment options continues to evolve, we can be optimistic about a future where this debilitating disease no longer defines the lives of those it affects. With continued research, innovation, and collaboration, a brighter future for Stargardt patients is within reach.